Welcome to the wonderful world of modern industrialized disease management. You know the drill. You hurt your knee, shoulder, or back, and you head to the local specialist. After 5 minutes of looking at a screen and 30 seconds of looking at you, they offer the holy trinity of failure. Ibuprofen, physical therapy that feels like a middle school gym class, and the piece de resistance, the cortisone shot. Unfortunately, they neglect to tell you that cortisone will literally speed the degeneration of the joint and will not fix anything. It is just a temporary, easy thing that insurance pays for that, kicks the can down the road. After a few of these, they stop working. That's if they ever did in the first place. Next, they'll offer you gel shots, which are much better and do not cause any damage. However, they are also a temporary fix. Finally, you'll be ready for a joint replacement. At least that's what they will tell you once it is bad enough that insurance will pay for it. I've spent over 45 years practicing regenerative health enhancement medicine as I watch this cycle repeat itself. It is a beautiful business model if you're a pharmaceutical company or medical device manufacturer, but it's a disaster if you're a human being who actually wants to move without groaning like a rusty gate. Modern medicine is the only industry where failure is a recurring revenue model. If your mechanic fixed your car by just cutting the wire to the check engine light, you'd fire him. Yet, when a doctor injects a chemical sledgehammer like cortisone into your joint to mask the pain while it accelerates the joint's degeneration, we call it standard of care. I'm Dr. Max McLeod. I trained as a doctor of osteopathic medicine and as a doctor of naturopathic medicine, in addition to earning a PhD in nutrition. I brought Prolotherapy to Sarasota back in the late 1990s. So if you're looking for Prolotherapy in Sarasota, you've come to the right place. I didn't do it because I liked needles. I did it because I was my own first patient. As a young, somewhat naive athlete who thought I was indestructible, I spent my teens and 20s doing stupid things like lifting small cars, doing flips off of park benches, playing football, soccer, and several other sports while sustaining enough musculoskeletal injuries to fill a textbook. I've had muscle tears, joint instability, and chronic pain in almost every major hinge of my body starting at about 13 years old. I was on a mission to get out of pain and keep performing. I literally started studying health, fitness, nutrition, and alternative medicine in 1969. Back to Prolotherapy, the technique that finally fixed my back pain. This isn't rocket science. If you want to stop the pain, you have to find and fix the cause of the pain. That is the only way to stop the degeneration and start the regenerative process. At the Age Reversal Technology Center, ARTC, we don't just manage your symptoms. We use a variety of therapies and tools, including the Wolverine Healing Protocol, to stimulate and support your own body's healing superpowers and do what it was designed to do, repair itself. Let's define the terms because the medical industrial complex loves to muddy the waters. Prolotherapy, or proliferation therapy, is the original regenerative injection therapy designed to stimulate the growth of new, healthy ligament and tendon tissue. We are literally proliferating new cells. Now, let's talk about the competition, the cortisone shot. Cortisone is a corticosteroid, a powerful anti-inflammatory. On the surface, that sounds great. Inflammation is bad, right? Wrong. Inflammation is the first step of healing. By injecting cortisone, you are essentially telling your body's repair crew to go home and take a nap. Sure, the pain goes away for a few weeks or months if you're very lucky because you've numbed the alarm system, but the structural integrity of the joint continues to crumble. In fact, multiple studies have shown that repeated corticosteroid injections actually accelerate joint degeneration and weaken tendons. It's like trying to fix a crumbling bridge by painting over the cracks. It may look better, but the next heavy truck that rolls over it may end up in the river. Prolotherapy and Sarasota protocols at ARTC are the exact opposite. We don't hide the pain and suppress inflammation. We fix the cause and take advantage of inflammation. Many different solutions have been used over the years. BTW, prolotherapy as a technique, was first published in 1937. Some of them were really strong and hurt like heck for days after treatment. Thankfully, that is no longer the case. Today, most of us use a solution of hypertonic dextrose, which essentially tricks the body into thinking there is a new injury, which activates a healing response. It effectively creates a controlled injury without actually causing any damage. This sounds counterintuitive, but by creating a tiny bit of irritation in the precise spot where your ligaments are loose or your tendons are frayed, we trick the body into sending a fresh wave of growth factors and specialized cells to the area. The real problem is that once injured tendons and ligaments only regain 50 to 80% of their original strength and are a bit longer. Why don't tendon and ligament injuries heal completely? Simply, they have a poor blood supply due to their density. Anyone who has ever sprained an ankle will tell you that it is never the same. So prolotherapy isn't a quick fix for people who want to feel better by Tuesday and be back in surgery by next year. This is for people who understand that biological age is more important than the number on their driver's license. If your joints are structurally sound, you are biologically younger. It's that simple. And if your joints are structurally weak, you are biologically older as a result. The human body is an amazing organism, but it tends to prioritize some things above others. It tries to put major efforts to stabilize and repair an injury on a short-term basis to allow you to survive, but often fails to complete the process 100% for a variety of reasons. When an injury becomes chronic, the body often gives up on trying to heal it and just accepts that it will never be at 100% again. All it cares about is whether you will survive in the here and now. So too often it settles into a state of permanent low-grade dysfunction. Prolotherapy acts as a wake-up call by reactivating the healing and regenerative cascade. When we perform prolotherapy and Sarasota injections, we are triggering a 3-phase healing cascade by tricking the body into thinking that there is a new injury right where you want it to repair. The inflammatory phase. For the first 48 to 96 hours, your body responds to the injection by releasing chemical messengers called cytokines. This helps to signal and bring increased blood, including white blood cells and growth factors, to the area. It also signals your body's resident stem cells to become active and repair the damage. You might feel a bit of stiffness or a good kind of ache, kind of like a post-workout soreness. This is the signal that the repair crew has arrived. The proliferative phase. Over the next few weeks, your body begins to lay down new collagen fibers that are made by the fibroblasts that have migrated to the area. This is the proliferation part because fibroblasts make collagen, which is the glue-like protein that provides most of the structural integrity of our bodies. This process is literally building new scaffolding, connecting your tendons and ligaments to your bones and the insides of your joints. According to research published in the National Institutes of Health, NIH database, dextrose prolotherapy has shown significant efficacy in reducing chronic musculoskeletal pain by stimulating these very pathways. The remodeling phase. This is where the new tissue matures and strengthens. The loose, sloppy ligaments that were causing your joint to grind and pop become tight, resilient, and supportive again. The full remodeling may take several months, but the basic collagen scaffolding takes about 6 weeks. This could not be further from the truth of what you get at a standard pain management clinic. They want you on a subscription model of pills and temporary shots. We want to build you a new joint, so you stop coming to see us for that specific problem. My goal is for you to be out there playing pickleball, tennis, golf, or riding your bike in Lakewood Ranch, not sitting in my waiting room or in front of your TV. While standard prolotherapy using dextrose is a fantastic foundation and far superior to the chemical lobotomy of cortisone at ARTC, we don't stop there. If we're going to fix you, let's do it with super physiologic power. Unfortunately, my observations over the past 30-plus years indicate that people simply don't heal as well these days. We have more stress, environmental toxins, nutritional challenges, and the negative effects of relatively sedentary lifestyles than any humans in history. Hence, our healing superpowers have been blunted. We use what I call the Wolverine healing protocol to overcome these challenges and deficits. While most clinics in Sarasota are just now figuring out or are still relying on platelet-rich plasma PRP, we've evolved way beyond that. We offer stem cell concentrates from umbilical-derived Wharton's jelly. We utilize high-quality, ethically sourced tissue concentrates that provide a dense matrix of growth factors and signaling molecules to jumpstart repair in even the most bone-on-bone scenarios. Note that we do not use stem cells to treat any condition, as they are not officially recognized to treat anything other than several types of cancer. We simply use them for their known signaling effects. They help to activate and revive your own stem cells to do what they are supposed to do. Exosomes. These are extracellular vesicles that contain hundreds of growth factors, cell signaling molecules, and messenger RNA that have many similar effects to stem cells. In fact, stem cells contain thousands of exosomes themselves. Think of them as cellular messengers that tell your existing cells exactly how to repair themselves while providing many of the needed raw materials. They are the software that runs the regenerative hardware. Nano-PRP, placental-derived, a more refined, potent version of traditional PRP that focuses on the growth factors, collagens, and specific proteins that shut down inflammation while ramping up repair. Basic PRP often fails. Basic PRP, platelet-rich plasma, is processed from a person's own blood to concentrate the growth factors and collagens. The problem is that the research was done on 20 to 25-year-old athletes who have high amounts of growth factors and collagens. As a person ages, both of those decline precipitously to a small fraction of one's younger levels. That's why PRP often fails in those over 40. But here's the real kicker, the thing no other clinic in Sarasota is doing. We combine these injections with our Wolverine healing protocol. We don't just inject you and send you home to sit on the couch. We integrate several additional components to support the healing and regenerative process. Comprehensive foundational nutritional support program because your cells need all the essential nutrients in significant amounts to repair, and most people are deficient in many of them. Shockwave therapy to stimulate blood supply, break up scar tissue and calcium deposits while stimulating collagen production, joint decompression/mobilization to help open up the joint space, thereby enhancing the exchange of fluids that are in the joint's synovial sac, which tend to become stagnant. Photobiomodulation/red light therapy to enhance circulation, increase local ATP production, and stimulate collagen production. Peptides, the medicine of the future and the past that isn't talked about. Peptides are all the rage and for good reason. They work. Unfortunately, the vast majority of them are not FDA approved, and they are therefore considered experimental. There are dozens of online sites selling them for research purposes only. Of course, that's complete BS. People are buying them to inject into themselves. We have sourced and made available high-purity peptides that enhance the healing response. The two top ones are BPC 157 and TB 500. Look them up to learn more. We now incorporate them into our Wolverine healing protocol. In fact, those two are known as the Wolverine stack. EWOT is another significant, although optional, component of the Wolverine healing protocol. Oxygen is the fuel for energy production and healing. By doing a targeted, low-impact session of EWOT immediately following or during your recovery window, we flood the treated joint with dissolved oxygen. It's like throwing high-octane gasoline on a fire, but in this case, it stimulates the healing response. We also utilize hyperbaric oxygen therapy, HBOT, and specialized liposomal nutrients to ensure your systemic environment is primed for success. You can't build a mansion with a crew that hasn't been fed. We feed your cells so they can build your joints. If it has a ligament, a tendon, or a joint capsule, prolotherapy can probably help it. I have treated thousands of patients over the past 3 decades using this technique, and the results are consistently life-changing. We consistently see great results for knee pain, from meniscus tears to that bone-on-bone osteoarthritis that your surgeon is salivating over. Back and neck pain, degenerative disc disease, sacroiliac SI, joint instability, and chronic whiplash. FYI, most low back pain is actually due to damaged sacroiliac and iliolumbar ligaments that regular orthopedic surgeons, pain management doctors, and chiropractors ignore. Hip pain. The capsular ligaments and tendon attachments are the root cause of the problem, and they respond well to regenerative injection therapy / prolotherapy. Shoulder issues, rotator cuff tears, labrum issues, and frozen shoulder. Elbow and wrist pain, tennis elbow, lateral epicondylitis, and carpal tunnel-related instability. Ankle and foot pain, chronic sprains, and plantar fasciitis. According to a systematic review on PubMed, prolotherapy is an effective treatment for lateral epicondylitis, often outperforming or matching more invasive options in long-term follow-ups. The data is there, but Big Pharma doesn't make money on dextrose and your body's own healing ability, so you won't see a commercial for it during the evening news. I get this question every day. Doc, should I get the sugar water, the blood stuff, exosomes, or the real stem cells? The answer is, it depends on how much degeneration we're fighting. Prolotherapy, dextrose. Perfect for mild ligament laxity or for someone on a budget who is willing to do a few more sessions to get the result. It's the old reliable of the regenerative world. Nano PRP, placenta-derived, better for actual tears and tendons or more moderate arthritis. It contains 10 plus times the growth factors and collagens of a healthy 20-year-old's blood. Stem cell concentrates and exosomes. These are for the more severe cases of damage and degeneration, which most orthopedic surgeons characterize as lost causes that require surgery. If you've been told you need a joint replacement, this is a serious alternative, perhaps your last and best hope. We are bringing in the heavy hitters to completely remodel the environment. At ARTC, we don't guess. We evaluate your unique biology, your goals, and your biological age to determine the right stack. We might even mix them. We call it the stack for a reason. We want to hit the problem from every possible angle and provide the optimum healing situation. First, let's kill a myth. No, it doesn't hurt nearly as much as your know-it-all brother-in-law said it would. The pain of the procedure lasts just a few seconds, and for most, no more than a 3 to 4 on the 1 to 10 pain scale. For those who are especially sensitive, we use local anesthetics to make the process as comfortable as possible. The procedure itself is quick. I've done more of these injections than 99% of the doctors on the planet. I brought prolotherapy to Sarasota in the late 90s, and I've refined the technique every year since. We use precision placement to ensure the solution goes exactly where the instability is. After the treatment, you'll be a bit sore. That's regeneration in action. Don't go home and take an Advil. You'll kill the process. We want that inflammation. It is a local, controlled inflammation that restarts the healing response. We'll give you a specific protocol to follow, usually involving movement, specific nutrients, and a home light therapy device, and gradually guide you regarding exercises and activities to support the healing process. Most patients require a series of 4 to 6 sessions, spaced about a week apart. Remember, we are building tissue, not painting a wall. Quality takes time. Look, I'm not going to give you a hard sell. I'm too old and too busy for that. If you want to keep getting cortisone shots until your bones are as soft as wet cardboard, that's your choice. If you want to go under the knife and hope the 10 to 15 year lifespan of a titanium knee is enough to get you to the finish line, go for it. But if you want a different path, one that respects your biology and uses the latest science to reverse the aging of your joints, then we should talk. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Thomas Edison, who was clearly a quack by modern standards, right? Prolotherapy is about restoring the human frame. It's about getting you back to lifting your grandkids or your golf clubs or even a small car, if that's your thing. Schedule a regenerative consultation in Sarasota today. Let's sit down, look at your history, and see if we can turn your degeneration back into regeneration. I'm serving patients in Sarasota, Lakewood Ranch, Bradenton, and some who fly in for treatment from afar. We'll help anyone brave enough to step outside the disease care system. Stop managing your pain, start curing it.